Hello and welcome to Pregnancy Info. Today we will discuss all about third month of pregnancy. In this video we will tell you the changes in the fetus and the changes in the mother's body and also the symptoms related to third month of pregnancy. Let's start our video with the size of a fetus in the 9th and 10th week of pregnancy. The embryo develops into a fetus after 10 weeks. It's 1 to 1.5 inches in length or 21 to 40 mm long. The size of fetus is 2 to 3 inches in 11 to 12 week of pregnancy. You can measure it in centimeters, which can be 6 to 7.5 centimeters. The weight of fetus is 28 grams or almost 1 pound. Now we will discuss that what happens during week 9 and 10. The embryo develops into fetus after 10th week. The tail disappears. Fingers and toes grow longer. The umbilical cord connects the abdomen of the fetus to the placenta. The placenta is attached to the wall of the uterus and it absorbs nutrients from the bloodstream. The cord carries nutrients and oxygen to the fetus and takes away waste from the fetus. Now we will discuss what happens during week 11 to 12. The fetus is now measured from the top of its head to its buttock. This is called crown rump length, CRL. Fingers and toes are no longer webbed as we described in the previous video. It is no more like the frog's webbed fingers and toes. Now they are separated like a human being. Bones are going to begin hardening. This process is not similar to all bones. The head bones are little bit softer than the others and the remaining bones are started to be hardened. Skin and fingernails begins to grow. So you can see that in the very early stage or in the first trimester, fingernails are also ready to grow. Changes triggered by hormones begins to make external sex organs appear, female or male. The fetus begins making spontaneous movements. Some females feel it and others cannot. Kidneys start making urine, or you can say the kidney has been started its working properly in this month. Early sweat glands appear. It means skin is undergoing the process of development and the sweat glands are appear. Eyelids are fused together. It means that eyelids are not separated and the eye cannot be blinked. It will be remained closed. Now we will discuss about the symptoms of pregnancy in the third month. Many of the pregnancy symptoms from the first to second months continue and sometimes worsen during the third month. You probably won't gain much weight during the third month of pregnancy, usually about 2 pounds. If you are overweight or underweight, you may experience a different rate of weight gain. Talk with your nurse or doctor about maintaining a healthy weight throughout your pregnancy. Increased vaginal discharge. A combination of pregnancy hormones and the increased blood supply in your body can lead to a bit more vaginal discharge that you might be used to, as long as it's clear or white and doesn't have a bad smell. It's probably nothing to worry about. Try to wear cotton underwear and loose, breathable clothes to help prevent vaginal infections. Chat with your healthcare provider if you are concerned with what's happening. Nausea. You might still be feeling queasy, but perhaps for not much longer. Many moms-to-be say their morning sickness begins to subside during this month, which is great news. If you are not so lucky, try eating bland foods like toast, rice, or bananas and sip on ginger ale or ginger tea to soothe your stomach. Fatigue. The sleepiness may continue this month as your body continues to nourish your little one. Rest when you can. Stay hydrated and do some moderate exercise as this is shown to improve sleep. Prenatal yoga, walking and swimming can be good choices, but talk to your healthcare provider before trying any new exercises. Skin changes. If you have noticed that the color of your nipple has started to be darkened, this is because your body is producing more melanin, a type of pigment. This extra melanin can also cause brown patches on your face, which is called chloasma. You might also notice a dark vertical line that runs from your belly button to the pubic area. This line might start to appear at third month pregnancy as your belly size starts to increase. Most of this discoloration will disappear or fade after your little one is born. Breast changes. Your breast may be growing and changing this month too. Your areolas may grow larger and darken, and your nipples may start to produce a little more. Under the surface, milk glands are preparing to produce milk and fat is being added to your breasts. If your bras feel too tight, it's probably time to go up a size. Go for a professional bra fitting at your local departmental or specially lingerie store to get a new bra and that is more comfortable. Constipation. Some pregnancy hormones can cause your digestive system to slow down, leading to constipation. The extra iron is your prenatal vitamin may also be to blame. Make sure to stay hydrated and eat more fibers. Fruits, vegetables, and more grains are great source of fibers. Hope you have understand all the symptoms and all the changes in the third month of pregnancy. If you are feeling this video is useful to you, then share it with your friend and family member and also subscribe my channel. Thank you.